Welcome to Nursing Question and Answers. Let's start the question. Expanded Program of Immunization Year in India? Option A, 1977. Option B, 1974. Option C, 1976. Option D, 1978. The correct answer is option D, 1978. OPV introduced in 1979. TT introduced in 1927. Universal Immunization Program introduced in 1985. Pulse polio eradication in 1995. 6 killer diseases are DPT, TB, polio, measles. Pentavalent vaccines are DPT, hepatitis B, Haemophilus influenzae type B. Next question. Immunization week is? Option A, May 24th to 30th. Option B, April 24th to 30th. Option C, January 24th to 30th. Option D, March 24th to 30th. The correct answer is option B, April 24th to 30th. Immunization day is Wednesday. Next question. BCG diluted with dash. Option A, sterile water. Option B, 0.9% sodium chloride. Option C, 0.4% sodium chloride. Option D, Ringer lactate. The correct answer is option B, 0.9% sodium chloride. BCG is live vaccine. 0.05 milliliter given at birth. It is given up to 1 year and stored in 4 to 8 degrees Celsius. Next question. Anticoagulant of choice in pregnancy. Option A, heparin. Option B, coumadin. Option C, phenidine. Option D, warfarin. The correct answer is option A, heparin. Anticoagulant prevent the occurrence of new clots. Thrombolytic are dissolved blood clots. Example, streptokinase and urokinase. Next question. Which color of the VVM central square indicates if the vaccine is safe use or not? VVM means vaccine while monitor. Option A, dark at center. Option B, green at center. Option C, white at center. Option D, blue at center. The correct answer is option C, white at center. The VVM introduced in 1998. Next question. All are live vaccines except option A, measles. Option B, BCG. Option C, rabies. Option D, rotavirus. The correct answer is option C, rabies. Next question. Wilms tumor is a malignant tumor that affects option A, brain. Option B, lungs. Option C, intestine. Option D, kidneys. The correct answer is option D, kidneys. Wilms tumor is a rare kidney cancer that mainly affects children. Wilms tumor also known as nephroblastoma. Next question. Formation of RBC in bone marrow is called option A, leukocytosis. Option B, phagocytosis. Option C, erythropoiesis. Option D, hematopoiesis. The correct answer is option C, erythropoiesis. Phagocytosis is a cellular process for ingesting and eliminating particles larger than 0.5 micrometer in diameter. Leukocytosis, a high level of white blood cells in the blood. Hematopoiesis is the formation of blood cellular components. Next question. The largest gland in the human body. Option A, pancreas. Option B, gallbladder. Option C, liver. Option D, spleen. The correct answer is option C, liver. Liver is the largest internal organ in our body. Next question. NPH insulin belongs to the category of option A, short-acting. Option B, intermediate-acting. Option C, rapid-acting. Option D, long-acting. The correct answer is option B, intermediate-acting. NPH means neutral protamine hagedorn insulin, also known as isophane insulin. Onset of effects in 90 minutes and last for 24 hours. Next question. Capacity of ice-lined refrigerator deep freezers. Option A, 100 liters. Option B, 140 liters. Option C, 200 liters. Option D, 300 liters. The correct answer is option D, 300 liters. Next question. The ideal temperature and pressure used for autoclaving? Option A, 120 degrees Celsius at 15 psi. Option B, 140 degrees Celsius at 14 psi. Option C, 130 degrees Celsius at 15 psi. Option D, 121 degrees Celsius at 15 psi. The correct answer is option D, 121 degrees Celsius at 15 psi. PSI stands for pounds per inch. Next question. Asbestosis is option A, waterborne disease. Option B, occupational disease. Option C, airborne disease. Option D, foodborne disease. The correct answer is option B, occupational disease. It is a chronic lung disease caused by inhaling asbestos fibers. Next question. Outbreak of disease in a bird population is option A, epidemic. Option B, endemic. Option C, zoonosis. Option D, eponytic. The correct answer is option D, eponytic. Exotic. Disease which are imported into a country. Example, rabies in UK. Zoonosis. An infection or infectious disease under natural conditions transmit from animals to man. Epidemic. Widespread occurrence of an infectious disease in a community at a particular time. Endemic. It is regularly occurring within an area. Next question. Vital statistics include all the following except option A, fetal deaths. Option B, birth rate. Option C, education rate. Option D, mortality rate. The correct answer is option C, education rate. Next question. If the Revolutionary Women and Child Health Campaign GoBFFF is formulated by option A, WHO. Option B, UNICEF. Option C, UNESCO. Option D, USAID. The correct answer is option B, UNICEF. G for growth monitoring. O for oral rehydration. B for breastfeeding. I for immunization. F for female education, food supplementation and family spacing. Next question. A project offering free treatment for all children below 18 years of age in Kerala. Option A, Arogya Kiranam. Option B, Amritam. Option C, Ardram. Option D, Ashwametham. The correct answer is option A, Arogya Kiranam. Amrotam Arogyam. Non-Communicable Disease Control Program. Ardram Mission improving basic infrastructure and quality of services. Ashwametham to identify all leprosy patients and provide them with treatment. It introduced in October 2016. Next question. The most common side effect in intrauterine devices. Option A, expulsion. Option B, pain. Option C, pelvic inflammatory disease. Option D, increased vaginal bleeding. The correct answer is Option D, increased vaginal bleeding. Next question. What is the maximum duration of MTP? Option A. At any time. Option B, up to 20 weeks. Option C, up to 24 weeks. Option D, up to 28 weeks. The correct answer is Option B, up to 20 weeks. MTP Act introduced in 1971 in India. Next question. Conducting medical camp for pap smear screening for carcinoma cervix is an example of Option A, primary prevention. Option B, secondary prevention. Option C, tertiary prevention. Option D, it is not a preventive strategy. The correct answer is Option B, secondary prevention. Primary prevention aimed at a susceptible population or individual. Example, education about healthy and safe habits. Secondary prevention, screening the patient to offer early detection and diagnosis. Tertiary prevention, reduce the severity of the disease. Thanks for watching. Like, share and subscribe.